Welcome back. Well, right up the street from us, really, and up El Toro, there in Lake Forest. In fact, I pass by it twice a day, coming to work and going home to work. Real fine facility that, we're pleased that have been with us for, I don't know, long time, Freedom Village. And we have Joel Nibla here today. Yeah, Freedom Village is, it's grown. I remember years ago going there for an event. You had a great chef there, but you've taken on other things over the years. You've really become sort of a community, and not only people might think of Freedom Village as a place to live, but it's so much more than that, hasn't it?
It is.
It's really grown.
It is, and we've been around for 28 years.
Mm-hmm.
And it started with the independent living, and then a few years after opening, then they built the healthcare center.
Yeah.
So the community as a whole, we do independent living, assisted living, and skilled nursing. And specifically with the assisted living and the skilled nursing, that component is open to the public. The independent living is part of a private setting where you would have to participate and join the community. But we're definitely open to the public, and in those two areas, and a lot of people, that misconception is still out there. So we always want to make sure that everyone's aware that we are catering to the South Orange County population, and specifically to the Laguna Woods population.
Yeah.
A unique program that we have is the Bridge to Home program. Mm-hmm. And the Bridge to Home program is a segue from when someone transitions into skilled nursing and they go to the hospital, or they have an elective surgery, knee or hip surgery. They come to Freedom Village in the skilled nursing, and when their time is finished, what we do is we offer the Bridge to Home program, which basically entails, it's a 5 to 7 day program where we transition them to assisted living. We manage their medication. We help them, do some additional walking, just to help them build their confidence before going back home. And actually, we have quite a few people that come to us from other skilled nursings here in South Orange County. Mm-hmm. So when they're finished there, they've heard about our Bridge to Home program, so they bring them over to Freedom Village. We take care of them for 5 to 7 days or longer, and then we get them back home safely. So we're really excited.
That's really nice.
It's an exclusive program that we offer because we offer the multi-tiered, all the components of long-term care.
Yeah, that is really great. And on the poster you brought in here, of course, you have your award-winning chef there.
We do, Chef Hugo.
Yeah, which we've had on before. Tell me about you got a Medicare 5-star rating. Tell me about that.
Yes, we're extremely proud of that. Now, about 4 or 5 years ago, Medicare and Medicaid, or CMS, they put together a program for the general population to be able to evaluate, what type of nursing home you would want. So they gave it a score, just like when you go to a dining. A lot of places, the county provides you with a A, B, or C. So they have a rating of 1 to 5, and this is a culmination of 3 components. 1, it's their annual inspections from Department of Public Health. 2, it's their staffing levels, and then 3, it's quality of care. So to get a 5, it takes anywhere from 1 to 5 years. And the numbers is a culmination of several components. So we are very proud to say that currently today, we're the only 5-star in South Orange County. So, and we've done that over the years, and it's a lot of hard work. One of the things that people look at when they go into nursing homes, and especially if they've gone for the first time, they're not quite sure what to look for. So they have a lot of preconceived ideas. So you can go to Nursing Home Compare, and they give you like a checklist of things to look for when you walk through. And you always want to make sure the residents are clean and people are smiling, and you can really feel the energy when you walk into a place, and you can get a sense, are you greeted? Is there a smile on people's face? Are they attentive? Are they promptly assisting you? So because we've been rooted, Freedom Village, as a pillar in the community, I've been with Freedom Village now for, I'm going on pushing 13 years. And that's really rare in our industry, where they're, and we keep our staff. We have 50 or more staff that's, been with us well over 10 years, So we take pride in that, and that provides us with an opportunity to provide continuity of care in our skilled nursing. So we're very, very proud of that. And I have to share that is not exclusively something that we've attained on our own. We have to maintain that partnership and with the physicians in the area, We've done that, and we've gotten the support from our premier partners, and we work really closely with Saddleback, Mission Hospital, as well as Hoag Hospital. So
very good. You just mentioned your physicians. Tell me about your medical directors. I know in the past you've brought some of them on, and you're going to do that in the future as well.
Yes, I will. We have, all skilled nursings have a medical director, just like any formal healthcare setting. So Dr. Haga is our medical director, but what's unique to Freedom Village is that we also have Dr. Roble, who does rounds weekly. And he's an orthopedic surgeon out of Saddleback Hospital. He's been on the program before, and I'll probably invite him again. Yeah. And so anyone that has had orthopedic surgery, knee or hip, he comes through in addition to their regular physician that's managing their care. He'll take a look at the resident, he'll take a look at the charts, see how things are going. And he's right here locally, South Coast Orthopedic Group, right here in this area. So we're proud to have him as a partner, as part of the medical director team, if you will. And then we also have Dr. Turner. And Dr. Turner is, he's a prominent psychiatrist in our industry, and he's partnered with Freedom Village. So every couple of weeks he'll come in and he'll do what we call a psychotropic review of any and all residents that are on specific types of medication. So he looks and evaluates. We try to get them in the right range of where they need to be. And also, if there's an immediate concern where someone's having a cognitively declining in some way, we'd have him come in and he would do a psych evaluation, and we would partner with them in trying to get people really at the highest quality of life. Yeah. And that's by appropriately managing the medication. So we do that with a team of professionals around us, in addition to their regular primary care physician.
And that's what makes you really special, I think, above all else. It's very unique. And as I said, Joel has brought on these gentlemen on before, and when you speak with them, you can see the level of care that's there, and the fact that you work with the different hospital organizations around here. The Medicare 5-star rating is just wonderful. It really is. And I know it takes a lot to earn that. Like any 5-star rating in any industry, it takes a lot.
That's true.
That's really great.
Yeah, thank you.
So something you've been doing a little bit is remodeling certain areas of the facility and parts of Freedom Village, and tell me about that.
Yeah, we have. In our independent living, we're getting to the final phases. We're almost there, but it's beautiful. And then at the healthcare center, we're probably about 60 to 70% completed. We've redone all the common areas, and we're going into the rooms now to do the remodels. But for those that have not come in to visit Freedom Village in quite a while, I always want to extend to them an invitation to come to our independent living programs, to come by the healthcare center and just take a tour. The best time to get acclimated with what your options are in terms of needing this type of service is when you don't need it. So, yeah. I mean, people can come and you don't have to have a reason. Just show up. Just say, I would like to get a tour of your community, or I would like to see the healthcare center and what this looks like. And we can walk you around, and at the same time, do a little education and maybe answer some questions that people might have if they're anticipating having some form of elective surgery. And that's not an acute situation where an event's happened and they're in the hospital. Sure. Now they're limited, and there's time constraints and making a selection of where you want to go. But obviously, if that does happen, you can always say, I want to go to Freedom Village. And then they would guide you to us.
Very good. And again, if people just want to make Freedom Village their home, they're independent, that's perfectly fine. What, as far as the independent living there, do you have different size apartments or rooms or whatever you might call them? Yeah. I would call them an apartment.
Yeah, we come back it's like a home, their home. So we do. We have a wide array of selections. Okay. And it just varies depending on when they're open. So if someone is interested in independent living, again, they can just walk in. We have our staff and our team of professional counselors are there and available to answer any questions, show them around. But I always encourage people, we do a lot of advertising in a lot of different venues, to get linked into Freedom Village on our Facebook, get linked into our website, find out when we're having one of our events. Diane Mason is, she heads that up in our marketing department. She's done a phenomenal job with the several years that she's been with us. And so it's a good way to come in. We generally do it around a nice meal where Chef Hugo puts on just an amazing event, and that's what I'm going to call an event. I encourage people to check us out on the website, find out the dates, and just come and join us.
All right, very good. And again, Freedom Village is up there in Lake Forest. It's just right up El Toro Road. And as you can see, they have a lot more to offer than just independent living. But if that's what you want, you got a great place there. You've got, you get wonderful meals. Everything's included. And please, is it called Link to Home? Is that what, Bridge to Home?
Bridge to Home.
Yeah, please keep that in mind. You may not need it right now, but what a great service that if you have some care in the hospital, and this is a great thing to do for a few days to transition to home. I think that's wonderful.
Yeah, we also do it's a form of we do a respite program.
Okay.
So in situations where maybe if it's a couple and one spouse is declining, or if a parent is now living with the children and they need they kind of need a respite also.
Yeah.
So then they can come to us, or if they're going to go on vacation, they can come to us for 3 to 5 days, 10 days, whatever it might be, and we'll take care of everything. Their meds, their meals, and cater to their needs. And so that's an option that's available to them too. They don't need to have a medical reason to come to our assisted living.
All right, very good. Good to see you again.
Yeah, same here.
We'll see you again soon.
Yep.
freedomvillage.org, very easy, and you can see all the different services that they had. From staying there as your residents to just a few days, they can help you out, and they got a really great caring staff there. Good to see you again, Joel.
Thank you very much.
All right, we'll be right back.